So cytopenia is quite uncommon at diagnosis in CLL. Excluding those who have an immune cytopenia, we found that in our cohort of around 800 patients, just 10% of them presented cytopenia at diagnosis. 2% had both anemia and thrombocytopenia, so that's quite uncommon. And we wanted to know if these patients who have both cytopenia presented a worse prognosis or more aggressive features. And we found that patients who had both anemia and thrombocytopenia had more features of an aggressive disease, like B symptoms, lymphadenopathy. They also were younger, and they had a higher median lymphocyte count. Then we wanted to know some data about survival in these patients, and we found that the time to first treatment was significantly shorter in patients who had both anemia and thrombocytopenia at diagnosis. We think that this is maybe because most of these patients, virtually all of them, needed immediate therapy for their CLL, while the others could wait for longer. Those who could wait for longer without needing treatment were those who only had thrombocytopenia diagnosis at a median of around 10 months. And so we all know that cytopenia is a bad prognostic feature in CLL, but not all patients with cytopenia will behave in the same way. And exploring that, we tried to test if patients who had cytopenia and other additional treatment criteria performed the same. And what we found is that patients who only had cytopenia as a treatment criterion, they had a much better overall survival than those patients who had additional treatment criteria, such as enlarging adenopathies or B symptoms. So then we wanted to know whether the patients whose cytopenia improved with treatment, if they could be compared with patients who never had cytopenia, matching for the same rise stage. And what we found is that not. Patients who had cytopenia at some point, even if this cytopenia improved with treatment, they presented a worse prognosis than both in PFS and overall survival than the patients with rise stages 0, 1, or 2 who never had cytopenia. So in conclusion, patients who have cytopenia and no other treatment criteria have a better outcome than patients who had additional treatment criteria. And in these patients in whom their cytopenia improved with treatment, they had a better prognosis than those who not, but that could not be comparable to the patients who never had cytopenia, who presented a much better prognosis.